Hey, it's me again. In this video, we're going to talk about kidney stones. If you've ever had a kidney stone, they can be extremely painful. I personally had a kidney stone at one time. I thought I was dying. I lost my sense of humor. I forgot who I am. I mean, it was torture because it was an internal pain. It happened in the middle of the night. I told my wife to drive me to the hospital. It was just unbearable. I could barely walk. And so... And then I realized, I said, you know what? I can do acupressure on this. And I did the acupressure and the stone just kind of popped right out. So kidney stones come from an imbalance with calcium, called calcium oxalate stones. There's different types of stones, but there's a couple reasons why people get kidney stones. Personally, myself, I always experiment with different detoxes. And I actually did a detox and it dislodged all sorts of things from my liver. And then the next couple of days, boom, I got a stone. So it released something. But here's the thing. If your pH is a bit too alkaline, you'll tend to develop more stones or soft tissue calcium. But this calcium doesn't just build up in the kidney. It can build up all over the place in the joints. There's arthritis, bursitis, tendinitis, and the eye is cataracts, and the arteries is plaquing. So the pH controls calcium. That's one aspect. And also low vitamin D levels or low vitamin K2 levels. These are fat-soluble vitamins that transport calcium. So if you're low on the fat-soluble vitamins because you don't consume any omega-3 fatty acids or fish oils that have these in them, or K2 is the new one that's coming out there, then calcium won't be transported that well, especially if you're taking calcium. So that's why you would need to take those. The worst calcium to take is calcium carbonate. That's limestone. A lot of people get kidney stones from taking that. A lot of the antacids are made with calcium carbonate too. And so when the stomach acid is too low, people get acid reflux. And I did a whole video on that. And so what happens is the lower bowel acids come up to the stomach and recruit. So acid reflux is really a situation where you have low stomach acid, and that means your pH isn't acid enough to handle calcium, so calcium doesn't transport well. On top of that, people take calcium carbonate and other antacids, and oh my gosh, that calcium just plugs everything up. You get kidney stones. That's one of the side effects. Or if you go on a low salt diet, salt and calcium do compete a bit, and if you don't have enough salt, the calcium could also block stuff as well. One of the best things to protect you against kidney stones on a natural aspect is lemon juice. If you take lemons, actual lemons, or lemon juice, and you put that in your water every time you drink water, that will protect the kidney stones from developing as a preventative thing, and also like the apple cider vinegar in with it. So in my book, I talk about the cranberry drink. That's really, really good to help clean out any buildup of excess calcium in the soft tissues. So those are some tips on kidney stones. And the other thing too, if you happen to get a kidney stone and you press over your kidney to try to milk it and push it downward on the left and right side, it can give you a lot of relief. Sometimes the kidneys just go right through that little tube, right through there, right into your bladder, and then they can come out a lot easier. So it's something you might want to try if you happen to be in a situation where you need some relief. Acupressure to the kidney, it really will help give you relief for kidney stones. I'll see you in the next video.